The Ford government tonight acknowledges its plan to move people out of hospitals and into long-term cares faster could mean that patients face bills of thousands of dollars a week if they refuse to go to a home that they did not choose. Yesterday, CityNews told you about this concern. Today, the Minister of Long-Term Care acknowledged it is the reality.
Are there instances where hospitals will be charging? Absolutely. If somebody refuses to move.
There are just under 2,000 patients in hospital waiting for a long-term care bed, and the wait can last months. Last week, the Ford government introduced new legislation aimed at moving them out of the hospital faster. It states there are certain actions to be carried out with or without consent, and a placement coordinator can select a home for a patient and authorize their admission to the home. But if patients refuse, advocates say it opens the door to hospitals charging exorbitant fees.
They are now going to discharge you on paper, and usually they can't actually send you anywhere because you're too ill. And they are going to charge you the uninsured rate, which is like $1,500 a day. It depends upon the hospital.
To prevent seniors from being coerced into long-term care homes against their will, will this government ban billing for hospital beds?
The answer is clearly no.
I agree that they should use that tool. Our goal is to free up beds.
Under the Health Act, hospitals have been able to charge fees to patients who refuse to leave since 1979. The opposition says the Ford government is allowing them to do it more.
This tool is a financial hammer that's going to come down on the residents of Ontario when they need care.
The government's motivation is to ease the strain on hospitals, which have been under tremendous pressure for years, a situation exacerbated by COVID. Roughly 24% of patients in hospital should be in an alternate form of care, like long-term care. Studies have shown the burden that puts on hospitals and patients. This one from McMaster University in 2019 states, delayed discharge represents a significant economic burden all over the world, and that for older adults, longer stay in hospital results in worsening their health outcomes, declining their functional status. Moving an elderly person to a long-term care home is often an emotional time. Finding the right home can be very challenging.
The problem is the system has been set up to fail. They've not kept up the long-term care homes. I mean, they talk about rebuilding, but there's still many, many homes to be rebuilt. The compliance in some homes is very poor, and so people don't want to go there. And so you have a system where it's not good to be in the hospital, but those long-term care homes may not be appropriate either.
I have asked the Ontario Hospital Association how many patients who refuse to leave hospital for long-term care have actually been billed these high numbers. Right now, I'm still waiting for a response.